The fastest growing cancer right now is HPV-related oropharyngeal cancers. This is an epidemic in our society, and I hear the potential for increase in the near future, and it's astonishing. And it's already really gotten to be a big deal. Years ago, and I didn't have all the tools that were available right now, I had to use basically visualization and then referral. But at that time, this was right after I started, new patient, had never been seen by us, came in, had some strange little irritation on the roof of her mouth. And it would have been something that you just overlook, but it didn't seem right. So I had her come back the next day, still there, still the same. So I sent her to the oral surgeon immediately. They sent her across the hall to the ENT. Within 4 days, they did radical surgery on her. They took out about 2/3 of her hard palate, most of her soft palate, and all of her teeth from her left canine going across to the right side. It turned out she had an extremely aggressive T-cell carcinoma. Life-threatening. Letter from the oncologist stating that she would have died within a couple of weeks. It was that kind of thing. And at that time I got lucky. I just felt funny about it. I mean, this was 30 years ago, and her life was threatened. But within the last month, I received an email from her with some jokes attached. She's still doing fine. She has some things that's changed her life a bit that she's had to accommodate, but she's lived a full life, and she smiles every day of her life now. And that's why we do this, and you all know that, to just stumble across that. But now there are systems you can use that you don't have to get lucky. You can no longer have to just visualize. There are tests. I strongly suggest the HPV risk test. It's a salivary test. Anybody that falls into the risk areas or the more likely to have problems, test them and go ahead and make sure that they're not at risk. And if they are, refer them to their physician, get them taken care of and at least watched so they don't fall into that group that's going to have harm. And it is one of the most satisfying things I've ever done. And I utilize that now just because I don't want to just visualize things. I want to actually quantify them. So if you need any more information on that subject, we have information on our website at drdansindelar.com.